Hi, I'm Dr. Dinesh Sirasena, and I'm a consultant in sport, musculoskeletal, and exercise medicine. I'm based in Singapore, and I've been practicing in this field for well over a decade. In that time, I've seen thousands of patients with joint pain, muscle pain, tendon pain, and back pain. You name it, I've probably seen it. And one of the things that strikes me consistently is how often people come to me having already been through the system. Multiple doctors, multiple therapists, scans, injections, months, or even years of treatment. And they're still in pain. Or maybe the pain has come back. Or maybe it's moved to a slightly different place. Or you fix one thing, and then something else starts hurting. Now, that's not because any of those practitioners they were seeing were incompetent. It's just because the system, as it exists today, tends to focus on where the pain is. And the pain, as you're going to find out today, is quite often lying to you about where the problem really is. And that's really what this video is about. So stay with me, because by the end of this, you're going to think about your body in a very different way. I want to start by talking to you directly. You are not imagining it, and you are not broken. The real problem just hasn't been found yet. And that brings me to the question that I think changes everything. What if the place that hurts isn't actually the problem? This single question reframes everything you thought you knew about pain. So here's the big idea, and quite honestly, it's quite a simple one. Every joint in your body, whether it's your knee, your shoulder, your hip, your ankle, or your spine, every joint has one fundamental job before anything else can happen. And that job is not strength, it's not flexibility, it's not power or endurance. It's stability. Because without stability, nothing else works as it should. Movement breaks down. Power generation breaks down. Balance, coordination, control, all of it becomes compromised. And when stability is lost, what do you get? Pain, tightness, trigger points, muscle knots, recurring injuries. The same problem keeps coming back over and over again. And these aren't random events. They are signals. Your body is trying to tell you something. Now, this model, with stability at the foundation and strength and flexibility built on top of it, isn't a new idea. Over 30 years ago, back in 1992, it was described as a framework for joint stability. It's been foundational to musculoskeletal medicine ever since. And what I'm going to talk to you today is about taking that framework and making it useful for you, the person experiencing pain. So how does stability actually work? What creates it? Now, think of every joint as being supported by a team of 6 players, 6 structures, each with a distinct role. And that joint is only as stable as this team working together. So first, we have bone. This is the foundation. The shape of the joint surfaces where they meet determines how load is distributed and where stability begins. The joint capsule, the sealed envelope around the joint. It manages pressure inside the joint, and crucially, it's packed with nerve endings that give your brain real-time information about where the joint is in space. That's called proprioception, your body's position sense. And then we have ligaments, the static restraints. They hold bones in place when muscles are not actively engaged. We have muscles and tendons, the dynamic stabilizers. These adjust in real time to every movement and load, constantly controlled by your nervous system. Then there's fascia, the connective web. It ties every structure together across the entire body, transmitting tension and integrating the whole system. And lastly, we have skin and soft tissue, the outer envelope, providing critical sensory feedback to the stability system. 6 players, each has its own job. Each one supports the other. Now, you've probably heard about all these elements individually, But here's the key insight that most people don't get. This is not a static system. These 6 layers don't all contribute equally all the time. The balance shifts between them constantly in a fluid, dynamic way, depending on what exactly you're asking your body to do at any given moment. At rest, your bones and capsule do most of the work. Passive structures carry the load with minimal energy cost. During normal movements, muscles take the lead. Dynamic stabilizers coordinate every step and gesture. At the end range, say a full squat or reaching overhead, a complete stretch, ligaments hold the line. Static restraints protect the joint at its limits. And then, if we have sudden load, an unexpected twist, a landing or an impact, the weakest link is always exposed first. And that is where pain begins. I'm going to show you a stability visualizer I put together so you can see how these proportions change in real time. If you are interested in having a copy of this so that you can share it and educate your patients, please do DM me and I'll be happy to send it to you. So here we are. What you're looking at is how each of the 6 layers contributes to joint stability, depending on what demand is being placed on the joint. Right now, at rest or standing still, sitting down or lying down, look at these proportions. Bone and joint architecture carries the majority of the load. Capsule does some, whereas ligaments and muscles are a much smaller proportion, and fascia and skin barely register. This is your body being extraordinarily efficient. At rest, you barely need your muscles to stabilize a joint. The passive structures, the ones that don't fatigue, they do the work. No energy cost, no active effort required. Now, let's see what happens the moment we introduce movement. Look at how the input from the muscles changes. It goes way up from where it was before. The dynamic stabilizers have stepped up and taken the lead. The passive structures have stepped back, still contributing, but no longer carrying the system alone. This is your nervous system operating in real time, reading feedback from the capsule, the fascia, the skin, and adjusting muscle activation continuously and automatically. The truth is, you don't even think about it, but it's extraordinarily complex. Now, let's push to end range, a deep squat, a full overhead reach, a complete stretch. Look at the ligaments. At normal movement, they were a smaller proportion, but here at the end range, they've stepped up to become the primary restraint. They are literally holding the line. And this is where the most important clinical view in this entire demonstration comes in. This is where the system is most vulnerable. When ligaments are the dominant stabilizer, any laxity in those ligaments is immediately exposed. The structure that's supposed to hold the line can no longer do so. And something else, usually the muscles or the fascia, has to compensate. And finally, that sudden, unexpected load. Muscles and ligaments are both near their peak simultaneously. The entire system is stress-related all at once. If anything is already compromised, if a ligament is lax, if a muscle group is inhibited or fatigued, this is when you get injured. The weakest link gives way. Now, can you see why I call this a dynamic, fluid model? It's never static. And it's not about any one structure in isolation. It's about the balance between all 6. So what happens when one layer in this team becomes compromised? Maybe you've sprained a ligament and it's never fully recovered. Maybe the joint capsule has thickened or become restricted. Maybe a muscle group has become inhibited from a previous injury or from disuse, or from years of sitting in a fixed position. When this happens, the other layers compensate. The body adapts. And at first, this works. And you carry on. You don't even notice. But with every gimme, there's a gotcha. The compensating structure takes on load it was never designed for. Over time, it overloads, it tightens, it develops trigger points, it becomes painful. And now you have two problems when you started off with one. The compensating structures are then compensated for. This is why your pain spreads. This is why your pain moves. And this is why your pain keeps coming back. Pain tells you when the cascade has arrived, not where it started. This is why so many treatments fail to produce lasting results. They target the loud, painful tissue, the tissue that's making all the noise, and they ignore the quiet, dysfunctional tissue behind it, the one that started the whole cascade. Treating the symptom without finding the source is like mopping the floor while the tap is still running. You'll never win. The painful site is often the victim. The dysfunctional site is often the culprit. Till you identify the culprit, pain will keep finding new ways to show up. To make this more concrete, let's take a look at 3 cases I've seen in the clinic. Firstly, we have the tennis elbow that just won't heal. The patient has had months of treatment. They've tried bracing, rest, injections. Each time, the pain settles, but each time it keeps coming back. The standard assumption is that the common extensor tendon at the lateral epicondyle is the problem, and it's painful. I'm not questioning that. But the real driver in a significant number of these patients is subtle laxity of the elbow joint itself. The radial collateral ligament has become slack. The joint is subtly unstable, and the extensor tendon is simply the overloaded compensator, recruited to maintain stability that the ligament should be providing. There's a concept called SMILE, symptomatic minor instability of the lateral elbow, and that describes exactly this. Treat the tendon, ignore the underlying instability, and you're mopping the floor. Let's consider another case, plantar fasciitis that keeps coming back. Imagine a patient who's been treated for months with shockwave therapy, orthotics. The heel settles, but the pain settles, but the pain also keeps coming back. Everyone treats the plantar fascia because that's where it hurts, right? But the real culprit here is laxity in the ankle ligaments causing a force imbalance. When the ankle ligaments, particularly the medial stabilizers, become insufficient, the foot loses its stable foundation. The arch drops. Force transmission through the foot is disrupted, and the plantar fascia is asked to do work as a compensating stabilizer. It absorbs compressive forces that it was never designed to handle indefinitely. Ankle stability loss creates compressive forces on the plantar fascia. That's what's driving the pain. Fix the ankle, and the heel finally gets a chance to get better. Lastly, let's consider chronic back pain, where there's muscle and fascia tightness. Imagine somebody who describes their back as always tight. Massage helps for a couple of days, and then the tightness returns. Dry needling, rehab, stretching, always the same pattern. What everyone is treating is the muscle tightness and soreness. But the real drivers are joint degeneration and ligament laxity in the spine. When the passive stability system, the ligaments and the joint structures are compromised, the paraspinal muscles and thoracolumbar fascia are recruited to compensate. They tighten to create support. They cannot switch off, because if they do, the spine loses its stability. Muscle and fascia respond to dysfunction in the spine by tightening and creating support. That is not a muscle problem. That is compensation. The massage releases it temporarily, and then the muscles tighten straight back up because the underlying problem hasn't been addressed. This is that framework. This is what was described over 30 years ago. A passive subsystem failure, active subsystem overcompensation. We've talked about 3 different joints, 3 completely different presentations. One underlying principle. The pain was telling the truth about where it hurt, but it was lying about where the problem was. I want to leave you with a challenge. Have you ever found yourself asking these questions? Why do I keep needing the brace or the orthotic? Because if the brace or the orthotic fixed the problem, you shouldn't need it indefinitely. But if you've been using them for months or even years, the cause hasn't been found yet. Why does the tape come off and the pain come back? Because external supports manage symptoms. They do not resolve the underlying instability. Why does the massage feel great for 2 days, then everything tightens up again? Because releasing a compensating muscle without fixing the cause means it will simply tighten up again. The load hasn't gone anywhere else. Why do pain-killing injections wear off? Because injections reduce inflammation. They don't restore the stability that was lost. Now, I want to be clear, and this is really important. None of these tools are bad. They all have their place as part of a complete treatment program. They manage symptoms, reduce pain, enable tissue healing, and also allow you to keep functioning. Let me leave you with 3 things to carry away from this video. Number 1, pain is a signal, not a diagnosis. Where it hurts tells you where the cascade has arrived. It doesn't always tell you where it started. Pain is the messenger, not the message. Stability is the framework. This single concept explains nearly everything in musculoskeletal medicine, from acute injuries to chronic recurring pain. Keep it in mind when you think about your own body, and always ask why. If something keeps coming back, the cause has not been found yet. Keep asking until you get a real answer. It's important to understand why some injuries happen suddenly and unpredictably, while others are entirely predictable and are as a result of a compensation cascade that's been building for months or years, and why chronic recurring injuries are preventable once you understand the stability model. If this video has raised any concerns or questions about your own situation, feel free to reach out to me.